qualifies as memory OK in situational memory, a memory problem in only one domain, example location or caregiver recognition, qualifies as memory OK in situational memory. True false, which of the following is a valid response for gender identity? A to B? AOB OMA NFC OUNC DON/A. Which of the following is a valid response for gender identity? A to B? AMA BNF false. Based on the Inter-RAI-LTCF coding guidelines, to qualify as having situational memory OK, Section C, Item 2D, the person must demonstrate both abilities. They must recognize the names and faces of frequently encountered caregivers, and they must know the location of places they regularly visit, such as their bedroom, the dining room, or the activity room. Therefore, if a person has a memory problem in even one of these domains, they do not meet the criteria for situational memory OK. Based on the Canadian LTCF credentialing manual, the correct answer is C UNC. According to the coding guidelines for item A to B, gender identity, UNC is a valid code used to indicate unknown when the person's gender was not known at the time of the assessment or is inadequately described. The other valid codes for gender identity, A to B, include M, male/man, for W, female/woman, X, non-binary, ASKD, prefer not to answer, ASKU, asked but unknown, NA, not asked. Note, the code is NA, not N/A. See UNC DN/A for medications administered in the last 3 days. Which of the following must be recorded? AO only the trade name, BO date of manufacture, CQ name, dose, and unit, DO patient's preference for medications administered in the last 3 days. Which of the following must be recorded? A only the trade name, B date of manufacture, C name, dose, and unit, D patient's preference based on the provided Inter-RAI-LTCF training materials. The correct answer is C name, dose, and unit. According to the guidelines for Section N1, list of all medications, when recording active prescriptions and over-the-counter medications taken in the last 3 days, you must document several specific details. These include the medication's name, A, the dose, B, and the unit, C, such as mg, ml, or puffs. You are also required to record the route of administration, frequency, and whether it is a PRN, as needed, medication. False. Based on the Canadian LTCF credentialing manual, the UNC code only means unknown, specifically, that the person's gender was not known at the time of assessment or is inadequately described. If a person refuses to answer, there is a separate code used, ASKD, which stands for prefer not to answer. The person was asked but declined to answer. When coding for gender identity, the UNC code means unknown or refuse to answer. True/false based on the provided Inter-RAI-LTCF training materials, the correct answer is B. The original admission date to the facility. According to the coding guidelines for item B2, date stay began. This date refers to when the person was admitted for the first time to your facility. Even if the person returns from a temporary hospital stay or a temporary leave, this date does not change. You must still enter their original and first admission date. The date stay began, item B2, should reflect, A. the most recent return from hospital, B. the original admission date to the facility, C. the date of most recent assessment, D. the date of first CIHI submission. When is the return date field required? A. for all discharges, B. when as is coded 3 for return assessment, C. when as is coded 5 or 6 for discharge with prior return, D. All of the above, E, B, and C based on the provided Canadian LTCF credentialing manual. The correct answer is E, B, and C. Note, as in your options appears to refer to item A8, reason for assessment. Here is the breakdown of why this is correct based on the coding guidelines. B is correct, according to the coding instructions for item A12, return date. This field can be left blank if item A8, reason for assessment, is not coded as 3 for a return assessment, which means it is a required field when A8 is coded as 3. C is correct. the manual outlines specific discharge scenarios called discharge assessment, return and discharge tracking only, return, which correspond to A8 codes 5 and 6. In both of these specific discharge scenarios, completing the return date field is explicitly required to capture the start date of the return stay before the person was discharged. Therefore, the return date is required for return. When coding memory, what must be considered for situational memory? A. The person can name the staff. B. The person remembers their room number only. C. The person can recognize caregivers and key places. D. The person can sing assessments and for specific discharge assessments that follow a prior return. The correct answer is C. The person can recognize caregivers and key places. According to the Inter-RAILTCF guidelines for assessing cognition, determining if a person's situational memory is okay, Section C, Item 2D, requires that they demonstrate both of the following abilities: 1. Recognizing the names and faces of caregivers they frequently encounter. 2. Knowing the location of places they regularly visit, such as their bedroom, the dining room, the activity room, or the therapy room. Because situational memory relies on both recognizing specific people and knowing key locations, option C is the only complete and correct choice. False. Based on the Inter-RAILTCF coding guidelines for Section C, Item C1, Cognitive Skills for Daily Decision Making, a code of 0 indicates that the person is independent, making independent, consistent, reasonable, and safe decisions. Minimally impaired is actually coded as a 2. Cognitive skills for daily decision-making coded as O indicates minimally impaired. True-false. Based on the provided Inter-RAILTCF training materials, the correct answer is A. A first assessment already submitted. According to the guidelines for a discharge tracking only, regular assessment, a first assessment must have already been submitted in the IRRS before this tracking assessment can be accepted. Furthermore, this type of assessment only records basic administrative discharge details, meaning only the identification information and discharge sections are completed, not all sections or Section N. A discharge tracking only, regular assessment requires A first assessment already submitted. B. No first assessment required. C. Only Section N completed. D. All sections including intake history. The correct answer is B. 7 days. According to the Inter-RAILTCF training materials, a first assessment must be completed and signed within 7 days after the assessment reference date, ARD. For example, if a resident's ARD is January 4th, the assessment must be signed as completed no later than January 11th. What is the maximum number of days allowed to complete and sign a first assessment? A. The ARD. A. 5 days. B. 7 days. C. 10 days. D. 14 days.